Hola a todos, vamos a dar un
Good morning to
minuto para
all. We're
que
going to give
puedan
you one more
ingresar
minute
todos a
to
la
allow
sala y
everyone
en
to
breve
enter the room,
comenzamos a esta
and
sesión
we'll start our
informativa
briefing
de
in a
la
few
OPS.
minutes.
Como saben, les
As you
recordamos
know,
que
we
nuestra
remind
página
you
web
that
en
our webpage,
www.paho.org/coronavirus pueden
www.paho.org/coronavirus,
encontrar toda la
you will
información
find all
actualizada
the
sobre la enfermedad,
information
las guías
up
de
to
la
date
OPS,
on
el
the
mapa con
information,
las
the guides, the
situaciones
map of the
y los
situation,
casos en los países
and
de nuestra
the
región. Así
cases
que ya en unos
of the
segundos
countries in the
vamos a estar
region. In a
comenzando
few
esta
seconds,
sesión.
we'll be starting this briefing.
Bien, ahora sí, entonces, buenos días y
Well, good
bienvenidos
morning.
a todos a
Welcome
esta
to
sesión
all to
informativa
this
semanal de la
weekly
OPS sobre
briefing
la pandemia
PAHO
por
on the
COVID-19 en la región
COVID-19
de las
pandemic in the
Américas.
region of the
Soy
Americas.
Sebastián Oriel del
I'm
Departamento
Sebastián
de
Oriel from
Comunicaciones.
the
Les
Communications
recordamos
Department,
que
and I
tenemos
want to remind you
interpretación
that we have
simultánea al
interpretation
inglés y al español
into
y
English
pueden
and
optar por
Spanish,
ella
and
en
you
el
can
botón de
choose it at
interpretación en
the
la barra de
interpretation button
abajo.
in the
La
lower
sesión va
bar.
a durar alrededor
The
de
session will
45
last around
minutos y
45
tomaremos
minutes,
preguntas
and
hasta
we'll
ese
receive
momento.
questions up until
Ya hemos
then.
recibido
We
preguntas
have
por correo
received a few
electrónico
questions
y
via
podrán
email,
hacer preguntas
and you
también
can
a
also
través del
ask your
botón de
questions
Q
through
y
the
A que pueden también encontrar
Q&A
en la
button
barra
that
de
you
abajo.
also find at
Y
the
también podrán levantar
bottom
la
of your
mano y les estaremos
screen.
dando
You
la
can also
palabra
raise your
en vivo,
hand, and we'll
pero
give you
antes sí les
the
pedimos que
floor
por favor nos
directly. But
escriban por
first,
el Q
please
y
write
A
to
para
us
que
through the
podamos
Q&A so that
organizarnos.
we can organize
Además, les
everything.
pedimos que se
Furthermore, we'd like to
identifiquen
ask you
con su
to
nombre y
identify
su medio
yourselves
de
with your
comunicación.
name and
Esta
your
sesión, como
media.
de costumbre,
As
puede
usual,
ser
this
seguida también
session
en las redes
may
sociales
be
de la
seen
OPS,
on
en
the PAHO
nuestros
social
canales de
networks,
Facebook
in
y de
the
Twitter.
Facebook and Twitter
Hoy la
channels.
directora de
Today,
la OPS, la doctora
PAHO's
Carissa
director,
Etienne,
Dr.
les
Carissa
informará
Etienne,
sobre la
will
situación
report to
actual de
you
la
on the current
pandemia en la
situation of the
región
pandemic in the
y
region,
compartirá lecciones
and will
aprendidas hasta el
share
momento en el
lessons learned to
control
date
de la pandemia
for the
por
control
COVID-19.
of the COVID
La
pandemic.
acompañan el
With
doctor
her,
Jarbas
Dr.
Barbosa,
Jarbas
subdirector de la
Barboso,
OPS,
Assistant Director
el
of
doctor Ciro
PAHO,
Ugarte,
Dr. Ciro
director del
Ugarte,
Departamento de
Director of the
Emergencias en
Emergency
Salud,
Department,
el
Health
doctor
Emergency
Marcos
Department, Dr.
Espinal, director
Marcos
del
Espinal,
Departamento
Director
de
of the
Enfermedades Transmisibles,
Communicable
y el
Diseases
doctor Silván
Department, and Dr.
Aldiguieri,
Silvan
director
Alighieri,
adjunto del
Assistant
Departamento de
Director of the
Emergencias de la
Emergencies,
OPS y
Health
gerente
Emergencies
de
Department,
incidentes
and
para
Manager of the
COVID-19.
Incidents
Ahora sí,
Group.
entonces quisiera invitar a la
I'd now like
doctora
to invite
Etienne a
Dr.
dar sus
Etienne
palabras de
to
apertura.
say
Doctora
her
Etienne.
opening words. Dr. Etienne, you have the floor.
Thank you, Sebastian. Let me welcome and thank you for joining us this morning. It has now been 10 weeks since our first weekly briefing on COVID-19 in the Americas. At that time, there were 163,000 cases reported in our region. Today, we are nearing 3 million. The epidemiological curve is still rising sharply in many areas. This means that more people will be sick tomorrow than were yesterday. Economies will remain strained, and societies will struggle with the new way of life that's being thrust upon them. Just in the past week, there were 732,000 new cases globally, and of these, more than 250,000 new cases were in Latin American countries, a serious concern that should serve as a clarion call to redouble our efforts. The entire region of the Americas accounted for more than half of new cases reported globally. Yes, the situation we faced is dire, but not hopeless, as long as our approach to defeating the virus is based on solidarity. We must work together, share resources, and apply the proven strategies that we have learned along the way. This is our way out. PAHO has been working with partners and governments across the region since January to prepare for COVID-19. The impact on our region has been severe, but it could have been worse. Health authorities at every level, local, state, and national, have implemented public health measures that flattened the curve in their communities. But the Americas are vast, diverse, and home to deep-rooted challenges that make stopping a virus complicated. We are facing 3 simultaneous emergencies: health, economic, and social. And we must address them in combination to stop COVID-19. And you may ask why. Because we are a region of massive inequalities. There are far more people who cannot access appropriate quality health care than those who can. We are a region of megacities where many people live in close quarters and share public spaces and transportation, and where poor or vulnerable groups often lack the means to stay at home and protect themselves. We are a region full of groups at greater risk of contracting and falling sick from the virus: indigenous populations, migrants, people with underlying health conditions like non-communicable diseases. And we are a region of underfunded, weak public health systems grappling with far more than COVID-19. We are simultaneously dealing with malaria, measles, dengue fever, and many other diseases. This means we must be especially determined and adaptable to the unique circumstances of our very diverse region. And we must remember that not all countries, cities, and communities are affected in the same way. We have learned a lot about COVID-19 since January, and I want to focus today on the lessons that I believe are most important for our region going forward as we organize to control COVID-19. First, think twice before lifting social distancing measures. Social distancing remains our best strategy for containing the spread of the virus. However, many places that have endured a couple months of stay-at-home orders are now planning to open up. We must be careful. My advice is do not open too fast, or you risk a resurgence of COVID-19 that could erase the advantage gained over the past few months. Consider a geographic approach to lockdown and opening up based on the transmission in specific locales as appropriate. Also, our recommendation has always been test, trace, treat, isolate. Social distancing slows transmission so that health services can test suspected cases, trace contacts, and treat and isolate patients. It is a combination that works as long as you adapt it to each setting. And it is a core strategy of many countries that have successfully controlled transmission. Second, don't make decisions in the dark. Surveillance is the most valuable tool to guide our public health actions. Even though testing capacity is not perfect, virtually all places in the region have sufficient data to track and monitor where the virus is spreading. This must drive our decision making. It will also help us better target much needed social support measures. Use data to tailor your response, protect vulnerable communities, and focus your efforts where new infections are on the rise. Preventive efforts are more effective when informed by surveillance. We still have an urgent need to expand testing. PAHO has been working with all countries on this issue from the start of the pandemic, and we will continue to focus on it to ensure capacity and supplies match the challenge. Finally, a point dear to my heart: strengthen your health systems. The past few months should have enabled countries to strengthen their health infrastructure for the wave that we knew was coming, especially improving hospital capacity. As cases rise, we must keep this up. Many places are overwhelmed, operating on the edge of their abilities, but we've consistently seen health systems rise to the occasion. PAHO has provided adaptable guidance, support, and has worked hand in hand with countries to prepare their health systems for a surge in infections. Engage private hospitals and social security facilities. Draw on the capacities of all sectors in a united resolve to respond to this pandemic. We have also provided guidance and supplies to help protect your health workforce. Let me remind you that your response to the pandemic depends on your health workforce being safe and healthy. And we are doing better with PPEs, but we need to keep supplies flowing as cases rise. Stigma towards healthcare workers must not be tolerated. They risk their lives to save ours, and they need our support now more than ever. PAHO is working in every single country and territory of the Americas to fight the pandemic. Our engine is solidarity. We know countries are stronger in their response if they can learn from one another, pool resources and expertise, and draw on the latest data and PAHO's support. Our region may face unique challenges to stopping COVID-19, but we are also uniquely positioned to overcome them. We have a tradition of Pan-Americanism, which is our guiding light since PAHO's founding in 1902. And this has helped us overcome countless outbreaks. Above all, we are a region that understands the power of working together and the value of ensuring that all members of our societies have access to the healthcare that they need to stay safe. And this is why that I am confident that we will make it through this together. Over.
Muchas gracias,
Thank you, Dr. Etienne. And we're now going to the questions. We received some via email, and then we'll go to the questions on the chat. Remember that we have the Q&A button where you can write your questions, and we will be reading them and sharing them with you. The first question now comes from several reporters, NPR, Bloomberg, Radio Jamaica, and Carol Morello from the Washington Post. And it is related to, it's in English.
President Trump recently announced that the United States would be withdrawn from the World Health Organization. What does this mean for PAHO, the financial implications? Doctora Etienne.
Thank you for this.
Gracias por esta pregunta. Déjeme decir que Estados Unidos ha sido uno de los apoyos financieros más grandes de la OPS y un aliado importante. Actualmente, 60% de nuestro presupuesto es de Estados Unidos. La OPS se fundó en 1902 con 10 países, incluido Estados Unidos. En aquel entonces, el presidente Theodore Roosevelt, para servir como el organismo de salud especializado de las Américas. Cuando se fundó la OMS en 1948, la OPS aceptó ser la oficina regional de las Américas para la OMS, sin ceder su identidad. Durante toda nuestra historia, durante las emergencias sanitarias como la que enfrentamos en este momento, así como en condiciones normales, hemos trabajado juntos para mejorar la salud y el bienestar de los pueblos de las Américas. Hemos trabajado con importantes organismos de las Naciones Unidas como el CDC, USAID, NIH, Often, ECHO, el Comando del Sonocur y ONGs. Estados Unidos ha trabajado mano a mano con la OPS y otros Estados miembros para ampliar la cobertura de vacunas, controlar brotes, responder a emergencias, eliminar la viruela y la poliomielitis de la región, entre muchos otros logros compartidos. Si el financiamiento de los Estados Unidos a la organización se pone en juego, significaría una contracción importante de la cooperación técnica a los Estados miembros. Yo confío en que juntos encontraremos una forma de seguir trabajando juntos con Estados Unidos como lo hemos hecho en los últimos 118 años. Gracias.
Muchas gracias,
Thank
doctora
you,
Etienne.
Dr. Etienne.
Siguiente
Our
pregunta
next question
de Francisco
is
Morele
from
de Cover
Francisco
News.
Morele from Cover News,
¿Tiene la
who asks,
OMS una
does
opinión
PAHO
sobre
have
las
any
distintas
opinion
formas de
amongst the
enfrentar el
different ways of
coronavirus en América?
facing coronavirus in the
¿Hay una
Americas?
mejor
Is there
o
any better
peor
way or worse
cuarentena
way
para
of
combatir el
quarantine
coronavirus?
to combat
Doctor Barbosa.
coronavirus? Dr. Barbosa. Thank you. Thank you for this question. Well, first, it's important to evaluate that each country of Latin America has a different situation. Even within each country, the settings are different. There are different situations of transmission between the provinces, states, or municipalities. So it's very important to assess the situation, as the director mentioned, and carry out adequate surveillance. And we're talking about the detection of all cases, testing all suspicious cases, monitoring correctly, and check your hospital beds, your ICU beds, your hospital capacity. There's no single prescription for all countries, but each authority in his own country must evaluate its situation and see if, and there's one thing that's had been proven by many other countries, which we don't have to prove again in the region, is that when we identify an increase in transmission, in the number of new cases that are being seen, then we have to implement measures such as social distancing and a quarantine or a social quarantine. They call it different ways in different places. But in summary, it has to be a package of measures capable of reducing the speed of the spread. I know it's a challenge in a region where we have so many poor and so many mm, people at a disadvantage and under difficult conditions. But for this reason, it is so important to have social support to reduce the impact and to get the population to follow these measures. Measures which must continue until we manage to flatten the curve, control the transmission, and once we control the transmission, which some countries have managed in some countries already, including some countries in our region, we already have countries where there's been no cases in some of the countries of the Caribbean, for example. There are other countries in Latin America where the spread of the disease is dropping. We have to wait a bit, of course, but we have to make sure that we analyze the situation carefully. And at the same time, as we implement these measures to reduce the speed of the transmission, to monitor the health services in the region. These are, I believe, the two main aspects that we have to work with very carefully in all the health authorities, because the countries themselves, when they're able to control the transmission and begin the planned and careful opening process, they have to monitor the situation, because the minute they identify in a given area an increase of new cases, they have to step back to avoid an increase of the transmission again and the production of serious cases be greater than the hospital capacity. This is a very delicate and objective monitoring that has to be done by all countries as they're doing, and PAHO is supporting in every way, because there is no specific measure that can be applied immediately to all places. So the concrete application must take into consideration the exact situation of the transmission. But we know, and this is definite, that we cannot curb the speed of the transmission, and we cannot allow it to follow its natural course, because in any health systems, even in the rich system, in the rich countries, this has been proven. The number of serious cases will always be greater than the hospital capacity, and then there's going to be a loss of
Muy
lives.
bien, gracias,
Thank you
doctor.
very much,
Para
Doctor.
la siguiente
The next question comes from Fernando Melios from r7.com from Sao Paulo. And he asks, Brazil has registered several political protests in recent weeks with a large number of persons, some without masks and crowding, even in places where the governments maintain the recommendation of stay at home. How does PAHO consider this in the midst of a pandemic? And to what extent could this worsen the situation? Dr. Espinal. Thank you for that question. It's a very important one. PAHO recommends that all our countries avoid mass meetings or crowds. It's been proven that crowds will contribute to spread the virus. And in countries like Brazil, for example, where we continue to see an unexpected rise in cases, and I'll give you two examples, for example. In the last week, there's been a rise in cases of 44%. The mortality is increasing, but aside from that, the number of municipalities reporting cases, for example, on the week of the 11th to the 25th of May, those 2 weeks, the municipalities had an increase of up to 68%, from 53 to 68%. So it's important, as Dr. Barbosa said, to implement measures as a package, because if we wash our hands, but then go to a protest with massive crowds and we don't use a mask and we don't keep the social distancing, then we're going to continue disseminating the disease. And we have to think of the elders, our parents, our grandparents, who are all locked down. Then when we come home, we may be bringing the disease to them. Our recommendation is that we avoid crowds and we implement all the non-pharmaceutical measures which will contribute to slow down the progress of the epidemic and slowly contribute to flatten the curve. Thank you very much. Thank you, doctor. The next question comes from Alvaro Llano from Perspective from Colombia, who says, from the beginning of the crisis, we've seen a purchase from several countries of Latin America, supplying the health services to respond to the high hospital demands and medical institutions demand. From PAHO, are the procurements being consolidated regionally to ensure these essential means through the strategic and revolving funds? Or are you considering to have medium-term plans to implement these procurements? Dr. Urgarte, could you answer that? Thank you, Alvaro, for that question. It is a very important one, and it is relevant for the region. In fact, through the global procurement system, which is a multi-institutional mechanism, we've been able to supply countries with some of the equipment and supplies needed. In this case, for the Americas, there's been of $146 million of purchases through the mechanism, of which 30 million are voluntary contributions coming from PAHO and WHO through other partners who've also contributed, such as Canada, United Kingdom, European Union, and Japan, amongst others. And $116 million coming from 12 countries of the Americas that are purchasing through this mechanism, and that's Argentina, Bahamas, Colombia, Costa Rica, Ecuador, Honduras, Mexico, Paraguay, Peru, Suriname, Trinidad and Tobago, and the Turk and Caicos. And I'd like to mention that these purchases and these materials are about to be shipped soon and will be reaching the countries. One of the first countries that will be receiving is Ecuador. They should be receiving within the next 24 to 48 hours. And the other countries that will be receiving in the next upcoming days will be Colombia, El Salvador, Paraguay, St. Kitts and Nevis, Venezuela, and Trinidad and Tobago. So these procurement mechanisms that are done through the strategic and revolving funds are mechanisms which are a key part of PAHO's work to reduce the impact of vaccine preventable diseases, as well as to provide the essential supplies and medications to the health services. And this is one of the issues that the Special Executive Committee of PAHO discussed last Friday, and specific resolutions were made to maintain this mechanism within COVID and beyond. Thank you. Thank you, Doctor. The next question comes from Andrew Karpinski from Vice, and also from Dennis Chabrol from News Talk Radio Guyana.
Andrew dice en inglés ambas, how many tribes, communities are there in the Amazon and how many have reported cases of coronavirus? Dennis dice, what specific assistance is being provided to Guyana and Brazil to deal with the impact of COVID-19 on indigenous Indians that are inherently vulnerable? Dr. Aldiguieri?
So thank you for these two questions. The prevention and control of COVID-19 among indigenous populations is really very high in the agenda of the Pan American Health Organization. We are very concerned regarding the trends and the last developments in the Amazon basin, but not only. Also, as we have a question from Guyana, I would like to highlight the importance of a collaborative work between the different countries of the Guyanese Shield, from Venezuela, Guyana, Suriname, French Guyana, and also the northern state of Brazil. During the last years, there is a previous history of outbreak response and control, dealing with measles, dealing with diphtheria. And we know all the challenges of this kind of response in these areas. There is also a very complex interaction between indigenous groups and the gold miners, legal or illegal gold miners, because there is legal and illegal movement of people across the borders. So the surveillance system are challenged. And it's why it's important to strengthen the surveillance system in the most remote settlements, combining indicator-based surveillance by case, but also event-based surveillance, surveillance of rumors, surveillance of other sources, mostly from the civil society, for triggering a very quick investigation. PAHO, the Pan American Health Organization, is working at regional level with different indigenous associations, including COICA in acronym in Spanish, the Confederation of Indigenous Association from the Amazon Basin. And PAHO also has developed, together with partners, guidelines for dealing with COVID control among indigenous groups. The main recommendation, following the question from our colleague in Guyana, is to ensure a very close collaboration with indigenous associations, linking indigenous groups to the decision-making process for ensuring going through the cultural barriers, including the linguistic barrier, and do it at national level, but also do it locally. And another recommendation during very recent, last Friday, I think, conference between PAHO, COICA, and other partners was also to ensure to have local national NGOs participating in the response, and also international NGOs that would supplement, that would complement the activities run by the different ministries of health of the countries in the Amazon. Thank you.
Bien, gracias, doctor. Ahora
Thank you,
vamos a...
doctor. And now we turn to questions over the chat and live questions. Uriel Velasquez from Despacho 105 from Nicaragua has a question, and so I will give him the floor. We'll hear the live question. Uriel, can you hear us?
Hola.
Hello?
Sí, te escuchamos.
Yes, we can hear you.
Sí, mi pregunta es
My
sobre el
question
caso
has to
de
do with
Nicaragua. ¿Qué
the case of
consecuencias puede
Nicaragua.
tener
What are the
para Nicaragua
consequences
estar
this might have
enfrentando
for Nicaragua? The
la
fact that
transmisión
we're
local
facing
comunitaria
local
de
community
coronavirus
spread of
en una
coronavirus
cuarentena?
in a
También
quarantine?
quisiera comentar que,
I
por ejemplo,
also
los datos de
wanted
la
to let
semana
you know
pasada
that the
del
data
Ministerio de
given
Salud
last week
revelaron un
by the Ministry of
incremento del
Health led to an
200%
increase
de
of
las muertes
200%
reconocidas oficialmente
in
por
the
COVID-19.
officially
Y
recognized deaths
pasamos de
caused by
279
COVID-19. We
a
went from
759
279 to
casos confirmados en apenas
759
una
confirmed
semana.
cases in barely
¿Cuál es
1
el
week.
análisis que hace la
What
OPS
is the
de
analysis
esos datos?
offered by
Y
PAHO
quisiera saber
regarding
también
those data?
cómo va
And
la
I also
comunicación
want to know how
con
you're
el
doing
gobierno de
with
Nicaragua
the
para
communication
la
established with the
solicitud que
government of
hicieron de visitar el
Nicaragua
país.
for the
Gracias.
request that they submitted. Thank you. How's the communication going with Nicaragua? Thank you, Uriel. Dr. Ugarte, could you take this question, please? Yes, thank you for the question, Uriel. The situation in Nicaragua is a highly concerning situation. The increase in the number of cases and deaths reported by the official source and by non-official sources show that community transmission, community spread is in a very difficult situation to control. And when one loses the trace of the virus, that you can avoid this transmission from continuing to spread when you have a social interaction, it is necessary to implement immediately, as we said last week, and as was announced by the director over a month ago, that we have to implement social distancing measures. And that is one of the most important mechanisms in order to save lives and to reduce the spread. In this regard, we ratified that this is an essential element. We've heard and we've received comments from several entities, including medical associations, that call on the population to implement social distancing measures and actions, and we agree with that measure. The number of cases and the number of deaths must be managed in a completely transparent form. That is the only way of being able to control the pandemic of COVID-19 in Nicaragua. At the same time, it is necessary to protect the health personnel because that is a front line of defense. And so taking the necessary measures, detection of cases, treatment of cases, and immediate isolation of all symptomatic cases, to search contacts, trace contacts, and adequate quarantine is an essential, a basic measure when we have the probability of following the virus. But if we cannot follow the virus and we see the emergence in the community, then there's no other measure to reduce, to bring down the number of deaths and the impact on society, no other than social distancing. And we call on public and private entities in the country to implement immediately that measure. Thank you. Thank you, Doctor. Let us now go to Ana Lucia Cola from Prensa Libre from Guatemala. Ana Lucia, you have the floor so that we can listen to the live question. Let me see if you can hear us. Yes. I have the following question. What is the impact of COVID-19 on the health of physicians, the health personnel, frontline health personnel dealing with patients? What are the problems that they're facing? We hear people talk about stress, but I would assume that there are other problems. And what are the long-term consequences on this personnel, health personnel? Thank you. Thank you, Ana Lucia. Dr. Barbosa, could you answer this question, please? Thank you, Ana Lucia. Unfortunately, in our region, in Latin America, we have some countries who report their health staff as physicians and nurses that are greatly dedicated to this cause. And it is very important to follow up cases, but not only cases, but deaths. And this is an appeal, a really strong appeal for health authorities in the different countries to review the implementation of all protection guidelines for health personnel and to check whether health professionals have the necessary individual PPE that has been standardized for each type of a procedure followed in hospitals and clinics. Because the concern of protecting our health professionals is very important because they are in the immediate response to people. And also, if we have outbreaks in hospitals amongst health professionals, they can also become a way of spreading the transmission and reducing the capacity of supply of services in hospitals and medical clinics and primary health services. So the protection of our health professionals is very important. And it is one of the efforts that is highly promoted by the Pan American Health Organization in order to provide technical assistance to countries. Besides technical guides for the profession of our professionals, we also need to expand access to PPEs for professionals and also tests, because expanding the test capability in each country for all suspected cases, but also for health professionals, is extremely important in order to protect them. Thank you. Thank you, doctor. And in follow-up to this question that is related to health professionals, but from a different point of view, Matias Luego from Netscape in Spanish says that in Argentina, there was a demonstration of physicians that was claiming lack of equipment, PPE equipment, and he's asking whether PAHO is concerned about the situation in the region, and also whether health professionals can be blamed, in quotes, for acting as vectors of the spread. Dr. Barbosa. Thank you. First of all, I don't think that they can be blamed for anything. They're not guilty for anything. What we have today, nurses, physicians, all professionals of health professionals team are doing everything within their possibility in order to provide the best of services, healthcare services to all people. It is very important that in any country, Argentina, Brazil, Chile, Colombia, Panama, in all countries in the region, it is important for health authorities to have the necessary conditions in order to implement in each hospital and in each clinic for all medical teams all the provisions and the technical guides in order to avoid the spread of the virus. This is essential in the response because health workers must be supported. They have to be motivated. They have to receive all the support and the necessary conditions so that they can continue with their good work. So I believe that it is very important in each country to have what they need so that this will contribute in a significant way in order to respond to the action guidelines and provision of adequate PPEs. Very well. Thank you very much, Doctor. We have another question from Douglas McIntosh from the Jamaica Information Service. Douglas asks in English.
Providing additional PCR test kits to assist member countries boost the number of tests that they need to conduct as part of measures to contain COVID-19? Dr. Alighieri?
Thank you to the colleague from Jamaica for this question. As our director, Dr. Etienne, highlighted during her speech, we have in the framework of the detection, the testing of the people. It's crucial really to expand the network of laboratory testing for COVID-19 at national level, but also at local level. This must be implemented in the context of the strengthening of the surveillance, ensuring the testing for all suspect cases. All suspect cases must access the laboratory testing. There are huge challenges in terms of market, in terms of access to PCR tests. The Pan American Organization, since the very beginning of this pandemic, early February to 2020, has supported directly the countries of this region and implemented, trained, and equipped, as of today, 34 national laboratories with a COVID testing in PCR. The Pan American organizations during the last 2 months, April and May, has distributed as a donation more than 3.4 million PCR tests to these 34 laboratory networks in the regions. However, the needs are higher than this, and the countries have now the option since the month of May to access the global market through a consortium, supply consortium at global level, where different agencies are contributing for accessing this test. We are talking about Pan American Health Organization, World Health Organization, UNICEF, and also the Global Fund for Malaria, TB, and HIV. And countries have the option to use this supply chain and to order, including with the funding that they have in their national budget for the response, and including also with the funding that the international banks are providing them to for the procurement of supply. But again, Pan American Health Organization is committed to keep supporting the national networks with PCR testing for the expansion of the response strategy and the testing component of this. Thank you.
Gracias, doctor. Siguientes preguntas.
Thank you, doctor. Next questions come from Brazil. We have several questions from journalists in Brazil on different issues on the situation, on the possibility of flattening the curve in Brazil, on testing, and also on social distancing measures. Ana Pinto from Folha de Sao Paulo is asking the following question in English.
Assess the current situation in Brazil, where the number of cases continue to grow day after day. How bad can the situation get in such a vast and unequal country? También Kevin Damasio del National Geographic de Brasil pregunta sobre
Kevin Damasio from National Geographic in Brazil is asking about testing, and he says in English,
state of the pandemic in Brazil, how important it is to increase the number of tests to control the spread of the virus. Is there an ideal ratio of tests per confirmed cases? Y también Marieta Casarré de la Agencia Brasil.
And Marieta Casarré from Agencia Brasil is asking whether there is a forecast or any ideas to when the curve will be flattened in the country. And Lara Pinheiro Globo says the following: does PAHO have any recommendation for Brazil regarding reopening the country since cases are still on the rise? This is something that has already been covered previously, but Dr. Espinal, can you answer these questions?
The various questions. The situation in Brazil is delicate, and we are very concerned because what we have seen is increases of cases, increases in mortality in the last week, and the message is that the mitigation measures that needs to continue to be implemented. We cannot generalize because every state, Brazil is a vast country, and states are different. But if we look at surveys that has been done by prestigious universities in Brazil, like Pelotas University, suggesting that low prevalence in states like Florianopolis, by high prevalence in other states, Amazonias and so on. We need to take this and suggest governors need to continue implementing measures. Brazil is not yet doing sufficient number of testing. It has improved about 4,300 per 1 million population. But there are countries doing 25,000 tests, 20,000 tests, 15,000 tests per 1 million population. So it is imperative that testing increase. Second of all, we are seeing in Brazil that the occupancy of intensive care unit beds is at a very worrisome level in some states, 80% in some of the states like, Ceará, Amapá, Maranhão. It is important that Brazil take action and those states to habilitate more beds because, and Dr. Barbosa referred to this before, the mitigation measures we're trying to do is to slow the advance of the epidemic. So definitely it's not enough to say we are doing, but the key issue is how can we do better? And our suggestion, and PAHO will continue working with Brazil and with the states to ensure we try to slow down this epidemic, minimize the number of deaths, and protect as much as possible the Brazilian population. But it is imperative. We have high rates in the states of Northeast and North, but we also have absolute number of cases, a huge amount, more than 100,000 cases, and the two big states, Sao Paulo and Rio, with an important number of total number of cases, and it's very difficult to say that this is going to stop, and the next few weeks will be crucial for Brazil, and it will depend how the package of actions are implemented in the country. Thank you very much.
Gracias, doctor. Tenemos también
Thank you, doctor. We also have several questions from journalists in Mexico, so let us bring them all together. Gabriela Sotomayor from Proceso says the following. Mexico is starting to go back to a new normal when it seems that it still hasn't reached the peak of the epidemic. And it says, and performing very few tests. What does PAHO think about this, and what are PAHO's recommendations for Mexico? Isabela Gonzalez from the newspaper Reforma in Mexico is also saying the following. If the government of Mexico has already decided to see areas in the coming days, how important is it to expand the capacity to perform tests? How important is it to expand the capacity or the ability to perform tests? In Uno TV, Ochoa in Mexico says, what does PAHO think by saying that part of the population in Mexico has started to go out and perform their usual activities in the so-called new normal, in spite of the fact that the light is still red for the entire country? Dr. Barbosa, could you answer this question? Yes, thank you. Several questions into one. But let me summarize what is going on. In a country such as Mexico, no doubt there are major differences between states. And these differences have to be taken into account. Once again, there is no magic formula. But if the spread continues to grow, that is an indication that we should not attempt to open up the economic activity immediately, because it might entail that the situation will worsen even more. So the situation in Mexico is that we find differences in different states, and the question as to whether the red areas, people are once again going out into the streets and walking around. That leads us to an important thought that we have to ponder upon this. As the director said, it is the first region in the world where we have so many people in a situation of poverty with so much economic and social inequalities, where we are facing the pandemic. So it is a challenge. It is an important challenge for all governments. What social protection measures, what economic support measures for the poorest population can be implemented in order to increase the participation of these people in social distancing measures, quarantine, lockdown that governments are implementing. Secondly, the government of Mexico, through the Ministry of Health, is deploying an effort in order to increase the number of tests. In the last 2 weeks, it acquired more tests, it activated more laboratories, even private labs, which should bring as a result an increase in the capacity. We don't have a specific rate of how many tests per 1 million inhabitants, but we must have sufficient tests in order to test all suspected cases. We must have sufficient tests in order to test contacts of these cases and to test health professionals. That is the minimum that is needed in a country, because you have health professionals, and with that, you protect the capacity of health services. And with all suspected cases and with contacts of these cases, you can trace, you can track the path followed by the virus and to start controlling it in order to bring down the spread. So the country is making that effort. We hope that in the coming days we will have a much greater capacity, not only in this country, but in all countries in Latin America, because this is a very important action in order to control the spread.
Muy bien, muchas gracias.
Very well,
por la
thank you,
pregunta.
Dr. Barbosa.
Ya estamos llegando al final
We
de
are
la
coming to the end of
partida,
this
así que
session.
vamos a pasar
So
a
let us now
última pregunta, que es de
go
Jorge
to the last
Valencia,
question, which is
estamos
Jorge
en el
Valencia
program de
from Avid Radio
y él
program,
pregunta en
and
inglés.
he asks in English.
Millions across the region work informally and live off their daily earnings. As governments implement physical isolation measures, these workers don't have access to wages and likely don't have access to food. Is this being considered by PAHO a public health issue? Doctora Etienne?
Thank you, Sebastian, and let me thank the reporters for this question. Let's face it, the disruptions that have been caused by COVID-19 have shaken our economies to their core. The sharp rise in unemployment across the region has already pushed families into poverty, and sadly, more will follow, particularly considering how much it has affected the informal sector for many people in the region. We understand that measures like social distancing poses a unique challenge for people that need to work every day to bring food to their homes. And we recognize that imposing those measures for weeks and even months becomes more and more difficult for those families. The pandemic has forced us to address three emergencies, and I've said that before. We need to address those three emergencies at the same time: health emergency, the social emergency, and the economic emergency. Every government is working on addressing the same issue: keeping their people safe without ruining the livelihoods of families and communities. It is a difficult balance to strike, but I want to think that it's not an impossible one. To be successful, we need a joint approach that addresses the public health, the economic, and the social challenges of the pandemic together. Countries will need to implement a cautious transition period, as we've said before, where we will continue to focus on health, but we must also look for ways to stimulate our region's economy and address poverty. And these are difficult issues to balance. We are working with ECLAC to address the economic and health impacts of COVID-19 in the Americas and to give countries some guidance on how to support their economies while building strong social protection networks and embracing evidence-based public health measures. PAHO is also in close dialogue with the IMF, with IDB, the World Bank, and others to coordinate on the economic response in the Americas and to ensure that future investments are aligned with the best evidence available to guide public health decision-making. As we conclude, let me take this opportunity to add that now is the time for solidarity in health in our region. We cannot and must not let COVID-19 to time and chance. And PAHO and its member states must leave no one behind. Together, we must succeed, or together we will fail. And we cannot let failure be our future. Thank you for accompanying us in this media briefing. Have a good day.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. And now we've come to the end of this briefing. As always, we will send you the opening statement and the recording of this session by email. And you can also continue to be in contact with us, and we will answer your questions as soon as possible. So thank you, everyone, for participating in this briefing, and we will be connected until next week. Thank you.